everyone. Thank you for being here. Excited to introduce Dr. Rishi Rattan to kick us off.
Hi, good morning, everyone. Thank you so much for joining. I appreciate you taking the time. We are going to be monitoring our chat box throughout this public live webinar that is also streaming. So if you have any questions, feel free to leave it in the chat box, either on YouTube or on Zoom, and we will be happy to get and talk to our panelists about your questions toward the end of this webinar. We will also make sure, if we're not able to get to it, that we still can get your question answered and the answer distributed if we're not able to get to it during the town hall. So we're here today really to talk about the pandemic and pandemics in general, because after this pandemic comes more pandemics. As we've seen with HIV, SARS, MERS, H1N1, Zika, and Ebola, deadly diseases are accelerating. We've been here before with irresponsible leaders and pandemics that resulted from bad policy choices, and we can prevent history from repeating itself. We win by maximizing the moment and using the momentum, responding to voters' justifiable anxiety, and putting forward a bold plan that demonstrates to Americans and the world that there is a plan to stop this nightmare, that we are willing to participate fully in it, and prevent this from happening again. I am currently right now a trauma surgeon and ICU physician in Miami, Florida, which is most recently the epicenter of the pandemic. The situation here, months into the pandemic, after we had months to prepare watching it spread in China and Italy, has been continuously frustrating. Just in the past weeks, as we are continuing to surge here in Florida as an epicenter, we have had waiting times of 3 days in the emergency room while people are waiting for ICU beds. We can't build ICU spaces fast enough, and we're the largest public hospital in the country. We have emergency situations and traumas where we're trying to manage those situations in the hallways because all the rooms are full. We have people who do not have COVID mixing in the same areas with people who do have COVID because we've run out of space. We have people who have COVID in open air areas because we've run out of enclosed spaces. The situation on the ground is absolutely dire. I look, and every week my team is a different team because healthcare workers are being infected every week by COVID, trying to take care of it with diminishing supplies of PPE in environments that were never intended to take care of diseases that could be transmitted through the air. It's a frustrating situation, and it's really clear that what's happening on the ground is a direct result of failure of leadership at the federal level. The ideas that are talked about in Washington, D.C. are not abstract. They're not just laws on a piece of paper. They have direct effects on me and my colleagues, our safety, our livelihood, and most importantly, the ability of our community to survive this pandemic. The Biden COVID plan is strong, and it's getting better. But from our experience on the front lines, which you'll hear about today, as practicing doctors, global health practitioners, policy experts, we've identified some gaps in the present Biden COVID plan that's important to fill. Building back better should include stopping COVID-19. It should include repealing the policies that perpetuate pandemics and replacing them with policies that ensure health, equity, and restitution for those who have had so much taken from them. A group of physicians and health experts and nurses, many from the ranks of Doctors for Biden, came together to draft this letter to Joe Biden that has been signed by over 1,500 luminaries, including professors, health policy experts, government officials, and deans of medical schools. Next week, we expect a congressional sign-on letter to be introduced to the House and the Senate that will make the same policy requests as the letter to the Biden campaign. Now, let's introduce some of the progressive leaders who have endorsed this call from action and hear from them more about the plan and what the next president should do and how Congress should proceed as they debate COVID-19 relief bills. Dr. Abdul El Sayed is a physician, epidemiologist, progressive activist, educator, author, speaker, and podcast host. He is the chair of the Southpaw Michigan and a political contributor at CNN. He's the author of Healing Politics, Calling for a Politics of Empathy to Cure Our Epidemic of Insecurity, and the forthcoming Medicare for All, a Citizen's Guide with Dr. Micah Johnson. He is the host of America Dissected, a podcast by Crooked Media, which goes beyond the headline to explore what really matters for our health. And finally, he is a scholar in residence at Wayne State University and American University, teaching at the intersection of public health, public policy, and politics. Thank you, Dr. El-Sayed, for joining us. Also joining us is Professor Jeffrey Sax. Professor Sax, world-renowned professor of economics, best-selling author, leader in sustainable development, and senior UN advisor. He is a leading expert on economic development, global macroeconomics, the escape from extreme poverty, the control of AIDS, malaria, and other diseases, and the battle against human-induced climate change. Professor Sax was a co-recipient of the Blue Planet Prize for his environmental leadership and has twice been named among Time Magazine's most influential world leaders. The New York Times called Sax probably the most important economist in the world. Professor Sax serves as the director of the Center for Sustainable Development at Columbia University and was the director of the Earth Institute from 2002 to 2016. Thank you, Professor Sax, for joining us.
Thank you.
And we also have Dr. Lixton. Dr. Lixton is an internist and pediatrician with Health Partners in St. Paul, Minnesota, and working on the front lines against COVID. She is an assistant professor of medicine at the University of Minnesota. She is a co-founder of the Minnesota Immigrant Health Alliance, co-chair of the health advocacy organization Our Stories, Our Health, and a board member of the Minnesota chapter of the American Academy of Pediatrics. She is also a 2020 and 2021 Leaders in Health Policy Fellow with the Society of General Internal Medicine. Welcome, Dr. Lixton, and I want to thank all of our panelists for taking the time to join us today to talk about their experiences leading on the front lines from a policy expert standpoint as well as a healthcare standpoint. We're going to start with Professor Sax. I'd like to hear about your ideas about COVID and pandemic policy as it relates to global health and zoonotic transmission, and what your thoughts are in how to address the COVID pandemic and the pandemics of the future.
Rishi, thank you very much. And thanks to all of the panelists for all that you're doing. And thanks to everybody that's participating, the activist community and Right to Health Action for this initiative. First, we better elect Vice President Biden. If Trump stays in office, this country is absolutely going to collapse and the world is at dire threat. The man is a psychopath and he is killing Americans massively, not only by his incompetence, but by his psychopathy, which is clearly evident and absolutely extreme and dangerous. The United States is out of control in this pandemic, yet it's a pandemic that could be controlled. We have doctors that are on the front lines and doing heroic things, but frankly, controlling a pandemic is to have people not be flooding the hospitals. It's to be breaking the transmission of the disease, stopping the cases. And we're not doing that because we have had no federal policy at all. And even Congress has really failed because it has focused on money for people in need, fine, but it has not focused on the public health. And of course, Trump has blocked anything meaningful and even made face masks a politically charged issue. Our country is nuts, I'm sorry to say. And it's extraordinarily dangerous. We've now had nearly 5 million confirmed cases, perhaps 10 times that in actual numbers. We have nearly 160,000 deaths now. It'll tip that balance in a very short period of time. We're just about at the worst end of the world in cases per capita, certainly for any major country, and in deaths per capita. And this is because a controllable pandemic is being controlled in a lot of places. And we should note that in the United States right now, there are estimated or confirmed cases, 480 deaths per million population. But as of an hour ago in New Zealand, it's 4 per million. In other words, 1/100th of what we have here. In Hong Kong, 5 per million, 1/100th. In Singapore, 5. In China, 3. In Vietnam, 0.1 per million, because they've only had 6 deaths in the whole country, and that's a poor country, but they implemented proper public health. What was missing here from the beginning was basically Trump killed the CDC, so we've had no public health response. We haven't had testing. We haven't had systematic use of face masks. It's been sporadic. It's been due to governors like DeSantis, who's beyond incompetent. And the result is mass deaths. If you want to stop the pandemic, which I think all of us do, it is basic public health, which means face masks, hygiene, physical distancing, testing, tracing, quarantining, or self-isolation, safe workplaces, stopping large gatherings, protecting congregate settings like elder care centers where tens of thousands of Americans have died as the virus has ripped through nursing homes and elder care centers. None of it has to happen. We have just failed incredibly because of the worst president in American history. This initiative of right to health is excellent. It identifies 4 critical areas. First, stopping the pandemic with a public health workforce. I thought we had one, but we've killed CDC and its allies throughout the country. So we need to build public health. It's unbelievable how we have failed compared to countries with 1/10 of our per capita income or lower. We just don't do it. And again, the federal failure is unreal. Second is access to healthcare for everybody. Again, in our country, we are the outlier of any rich country in this for-profit exclusionary health system. And so the initiative calls for access for the vaccines and the drugs, because we're not even assured of that, even though the feds are paying for the research and development. Then they give it to the private companies like Gilead, which is a monster of overcharging, rapaciousness, taking medicines developed by NIH and then charging 100 or 1,000 times more than the production cost. And that's the game of our plutocratic politics. So that's the second area, is healthcare access. The third is global cooperation, because it takes a psychopath to pull the United States out of WHO at the height of the pandemic. You just can't even say anything more except that he is the most dangerous person ever to hold that office in the history of the United States. And still he has a 40% approval rating in this country, which is a measure of the propaganda of News Corp, what Murdoch has done in cahoots with Trump to absolutely propagandize this country. And the fourth is to build back with sustainability. I'm looking out my window now. The hurricane has just arrived. We're getting sheets of rain as I look. The whole planet is in turmoil. We have 100-degree temperatures in the Arctic Circle and in Siberia. We have massive infestations of locusts in the Horn of Africa. We have heat waves, record temperatures all over the world, droughts, floods. But the imbeciles like Trump or Bolsonaro, corrupt politicians to the core, deny the pandemic and they deny climate change. And so that's why the countries that are the worst on one are the worst on the others, because this is a complete game of plutocracy and anti-science. So the fourth point of right to health is to build back sensibly and sustainably as if lives matter. Well, let me stop there just to say that this initiative is fantastic. We have to elect Vice President Biden at all costs, because otherwise the threats to this world are beyond calculation. Actually, they're so immense. The 4 categories of stopping the pandemic, access to healthcare, global cooperation, and sustainability in all that we do, including climate change, are 4 crucial pillars for our well-being. Support the letter, support the initiative, support Vice President Biden's election, and let Congress know it's not just money right now. It is public health and saving lives. And I think the Democrats know that. The Republicans are as nasty as can be on this, following the lead of the psychopath in chief. We've got to send the message. Thank you for your activism.
Thank you so much, Professor Sax, for that eloquent and powerful overview of the situation that we're in, and the truth and the realization that the decisions that are being made within the White House and in this administration have global effects and global ripple effects that will last for years to come, quite potentially. And the reality is that we can't stop a pandemic anywhere until we are willing to stop it everywhere. And again, as you mentioned, it's not something that can be compartmentalized. It is related to climate change and all the global health, global trade, and global security policies that are going on right now. That's really what fuels the spread of a pandemic so quickly. So thank you again. Next, I'd like to hear from Dr. El-Sayed, particularly about what he thinks we can really do in moving policy forward to respond to COVID and future pandemics, and really what we should be doing now related to contact tracing and access to essential medicines. Dr. El-Sayed, thank you so much for joining us.
Thank you so much for having me. And first and foremost, I just want to say how grateful I am to the advocates and activists and policy minds at Right to Health Action. Really grateful to you for your leadership and recognizing this moment of drawing upon the collective experiences of healthcare workers on the front lines battling this pandemic to educate and inform what we need to do to make sure that something like this never happens again. I also just want to thank all of the organizers for this event. Thank you so much for your efforts in putting this together and creating a space for us to have a conversation about the future we want to build. And grateful to my fellow panelists, Dr. Lixton, and of course, Professor Jeff Sax. I want to echo first and foremost, actually, the 2 critical points that that Professor Sax made. Number one, I started my career studying the social determinants of health, and what is clear, and we don't always talk about in public health, is that politics is one of those social determinants. And I hate to say it, but Donald Trump has become a social determinant of ill health in this country. It's not just his incompetence. It's not just his failure to lead. It is also the fact that he has polarized our society to the point where he has, in effect, made collective action, which is, of course, the lifeblood of public health, nearly impossible by specifically targeting those things that we need most to take on this pandemic, whether it is science itself, whether it's our public health agencies like the CDC, whether it's scientists like Dr. Fauci, or it's public health interventions like masks and lockdowns. He has made these into pariahs in the base that he commands. And in that respect has unfortunately led so many of the people that that supported him to poor health and ultimately deathbeds, because we are watching this pandemic continue to dig through a lot of those communities that had thought that they were unfortunately immune simply because the pandemic hadn't made its way there. We've got a responsibility to act. And I want to say that I am super grateful to have had the opportunity to serve on the Biden-Sanders Unity Healthcare Task Force that helped to develop a lot of these recommendations. And as we were working through the months of May and June to put together a consensus document. Although I'm a broad and big supporter of Medicare for all, and this is not part of the Democratic platform nor Joe Biden's platform, though I'm not satisfied with where it's come, I'm optimistic about where it can go. And I know that there is no way forward in this country toward any of the goals that progressives believe in without electing Joe Biden president in 2020, ridding our country of the threat to democracy that is Donald Trump, addressing this key social determinant of public health. And so I stand behind these task force recommendations, recognizing that they don't go far enough, and also recognizing that they are a building point from which to build and continue to drive forward. And that is also the spirit in which I'm engaging today's discussion. You know, we certified these task force recommendations in June, only to watch as the pandemic got even worse, despite the very different trajectory in other countries. And what it's shown us is that we have to meet this pandemic where it's headed, not just stave it off at where it is. And, you know, of course, the fact is that if you want to understand the dynamics of a pandemic, the easiest way to visualize it is like a fire. If you can't put out the fire when it's a toaster fire, it's going to engulf the house. And if you can't put it out when it's taken on the house, it's going to take the neighborhood. And unfortunately, we've been operating in this country with proverbially the fire alarms with the batteries taken out of them and a furloughed fire staff. And so we have watched as this pandemic has raged. It is now a 4-alarm inferno, and we never had to get there. And the recommendations of this pandemic prevention plan really are about making sure that the next one never happens, because it's always better to be in a position where you're preventing a fire than when you're trying to battle one after it's gotten so big. And there are a couple of pieces of this plan that I want to speak to in particular. One is that we in this country, unfortunately, have watched as public health agencies, both federally and locally, have had their budgets stripped, which is what has left us in a position unable to take on this pandemic when we needed our public health agencies most. And we need to make them whole. And this plan calls for the equivalent of a public health corps, a group of workers who can be mobilized in situations like this to keep our country safe and protect one another. We're seeing the failure of not having this and the fact that contact tracing has not been able to keep down transmission rates in communities. And we've seen this failure even before this pandemic ever happened, because of course, you know, oftentimes we think about normal as if it was some incredible circumstance before the pandemic happened. But the fact of the matter is 10% of people at normal didn't have health insurance. And so many people died unnecessarily of preventable illnesses that, of course, this prevention core, this public health containment core, could be a part of helping to take on. And so we need to be thinking about creating a permanent standing public health force in this country, rebuilding what exists through the National Public Health Service and the CDC, but also investing in high quality jobs that come with union benefits and the opportunity to know that you are going to be cared for and your family is going to be cared for while you do the work of preventing serious illness in your country through this kind of a service. And so this is the opportunity, I believe, through Build Back Better to be able to think through this kind of public health service corps and to make it a profession in our country that is well supported, well remunerated, and comes with benefits and union capacity. And the other is on prescription drugs. Now, the Unity Task Force recommendations, I think, go further than we've ever seen on prescription drug pricing in this country, but we can go further. And you know, in the platform, Medicare will have the opportunity to negotiate prescription drug costs on behalf of everyone in America, not just Medicare beneficiaries. And that is a big deal. For the first time, it would be our country standing up and stepping up to the greed of the pharmaceutical industry to bargain on behalf of the people. Now, the place where I think we can go further and where this plan calls us to go further is in stepping up and giving the federal government the capacity to revoke patents, which would guarantee the rights of these pharmaceuticals if and when they don't want to play ball because they believe that that they can continue to dupe the people into paying absurdly high prices that are bankrupting Americans at every turn. But the second opportunity is also to make sure that as one of the biggest fish in the proverbial pond, that we're not creating circumstances in our country where we're raising drug prices for everyone else. And we found that 193 of 194 WHO member states supported a resolution at the last World Health Assembly to promote public and private promoted contributing public and private research to an open source medicines patent pool. And what that does is it assures that if the citizens of any one country pay into the production of a prescription drugs, that the citizens of the world get to benefit from that too. And you can guess who the 194th country not to sign on was, and it was ours. And we have an opportunity, even as we work on global governance around public health, as Professor Sax talked about, that we make sure that we are a full participant in that work by recognizing that we need to be a global partner in contributing to this patent pool to reduce prescription drug prices for the entire world. And that is an opportunity that I think we have to continue to build upon a plan that would keep us safe, that would keep us secure, that would provide healthcare for Americans. I want to echo again that nothing short of democracy is on the line here, that if we are unable to win this election in 2020, I am not certain that we are going to have the democratic platform to be able to fight for all of the reforms that we deserve, that we need, that people have been suffering without for far too long. And so it is critical that we do everything we can to get behind Joe Biden and make sure that he is president in 2020. And part of that means thinking through all of the policy questions that need to be answered to continue to promote and empower his platform to give us the best chances of winning in 2020. I believe deeply in the work that we need to do over the next 95 days to together to win this election, to defeat Donald Trump, to send him packing, to save democracy from fascism, and to empower our country to take on this pandemic, to take it down and to make sure it never happens again. I believe that this plan is a step in that direction and an opportunity to continue to build and to work together to empower our frontline healthcare workers, to protect our people, and to inspire folks about who we can be when we do our best toward collective action for the public good.
Thank you, El-Sayed, and to both Professor Sax and Dr. El-Sayed. I think their comments about the policy changes that we need really dovetail well together and show that there's really, particularly this pandemic has showed us there's a loss of borders here and a lack of distinction between what's happening on the ground here in the U.S. and what needs to be happening. When we look here on the ground, again, I just want to underline what Dr. El-Sayed said, is that this public health core that he's been talking about and that Biden's talking about, the 300,000 jobs, this is not volunteer work to prevent pandemics. These should be unionized, permanent jobs. There's a lot to do, not only around the pandemic, but beyond that this public health core could be in vulnerable communities across the United States. And this would be a commitment not just to the U.S. citizens, but this sort of philosophy of really stepping up and showing up in this way rather than looking for a volunteer corps is a really important point that I think could be an opportunity improvement for the Biden plan. And can also be looked at on a global level where we show up on the global scale and make sure that we are also supporting the public sector for other countries so that they can also respond to pandemics. Pandemics, as we have seen, usually do not start in the United States, but it's very hard to escape it once it's started. And so it not only helps us, but helps the entire world if we not only just support our public sector, but when we are investing like the Biden plan wants to in the global health sphere, that we also support the public sector of other countries as well and make sure those funds are going exactly where they need to be going to support the infrastructure to respond to pandemics where they start. So thank you again for both of your comments. Now I'd like to go to Dr. Hannah Lixton, who holds sort of a unique position, and I'm excited to hear from her because in addition to her work as a health leader and health policy expert, she's actually been on the front lines of this pandemic, treating COVID patients, responding to it. So she's seeing both sides and really straddles the world between what's going on in the halls of power and the ivory tower, so to speak, and what those effects are on the ground with her patients and her own livelihood. So we're really excited to have Dr. Lixton here today to share with us those connections, and thank you for joining us.
Well, thank you, Dr. Rattan, and thank you, Dr. Sax and Dr. El-Sayed. It's really been a pleasure to hear from you and really an honor to be speaking on this panel with you today. So like you said, that's exactly why I'm here, is because I I'm here really for my patients. I'm a primary care doctor, and often our patients don't have a voice, and so I'm really here to elevate their experiences and the ways that the policy decisions that we make on a global scale really affect individuals. And so, I'm here because while we're debating these policies, my patients, like your patients and people around this country and the world, are suffering, and many are dying, and the health of our community is suffering too. I want to focus in a little bit and start by talking about contact tracing. This is a concept we talk about a lot, but I suspect that many who have not themselves been diagnosed with COVID don't totally understand what it entails. Contact tracing, when it's done well, is incredibly intimate. Because in order to track and limit the spread of this virus, we ask people to share some of the most intimate details of their lives, who they spend time with, exactly when and where, the names and addresses, phone numbers, and the workplaces of their family and friends. So think for a second, how comfortable would you be in sharing all of that information with someone you've never met before, someone who's on the other side of a phone, who can't show you their face, their credentials, or any identifying information, someone who works for an agency that you don't understand and for a government that you may not trust? So essentially, how much do you trust that this information, this very, very personal information that you're sharing, will only be used to help with health and won't be used to harm anybody that you care about? I want to tell you about one of my patients and her experience. I've changed some of her identifying information, but this story is true and I am sharing it with permission. Sophia is a nurse at a nursing home. She's 26 and had her first baby back in March. Everyone was healthy. In April, she went back to work, and in May, she got sick with COVID. So while she didn't have to go to the hospital, she was really sick, so sick that she couldn't care for her child at home and had to bring her newborn baby to her family to care for her. And a few days into her illness, she got her first voicemail from the health department. The next day, she missed the call because she was sick. The next day, she got another message, and this one was not friendly. The person called saying that she was required to call them back and give them all the contact tracing information, names, addresses, phone numbers of everybody she's been in contact with. My patient, Sophia, she's a US citizen, but she has some friends and family who aren't, people who are living in this country without legal documentation. So she was really hesitant about this. Honestly, she told me was that she was afraid that the information she could share would be used to harm her family. She said, but by the third or fourth call she got from the health department, she felt like it was nothing more than harassment. And by the time her parents started getting calls to their home, an address and phone number that my patient Sophia had not shared with anybody, she was terrified. She said that even though as a nurse, she completely understood the point of contact tracing and why it was so important, she did not feel safe talking to anyone. So why do I tell you this story? It's because we failed. We as a healthcare system, as a public health system, we failed Sophia and her family, and we failed countless others in similar situations. First, we denied her any sort of paid maternity leave, any paid family leave after the birth of her baby. So instead of being home with her newborn, she had to go back to work 4 weeks after giving birth in the middle of a pandemic. Second, when she did go back to work as a healthcare provider in a nursing home, she didn't have the PPE that she needed to stay safe while caring for patients. And finally, when she did get sick, instead of reaching out to her for support to help her, we reached out to her in such a way as to cause fear rather than trust. And the people who called her did it without any comprehension of the realities of her life. They did not understand her fears, or her needs. And because of that, we weren't able to find out which of her family members or friends might have also been at risk for COVID and needed to quarantine. Because of our systemic failure, we couldn't stop the spread of this pandemic. The federal policies we're talking about today have a very real impact on the lives of my patients, and the details matter. Like Dr. Rattan was saying, if we have a public health corps made up entirely of volunteers or people who are getting only a small stipend, something like AmeriCorps, who realistically would take those jobs? Who'd be able to take those jobs? Only the people who could afford to. And those are people who are already financially secure. And those, by and large, are not the people who live in the communities that have been hardest hit by this pandemic, the people who need support the most. So instead, we should be building a public health core that creates really solid, good jobs in the communities that need help the most, that are the most affected. Provide a solid wage with union support and quality benefits to the people who join so that people can keep that good job and help end this pandemic in their own communities with a real understanding of the needs of the people they're serving. So that's one example. And I have more, but we have limited time. So the other thing I want to touch on real quick is the very real issue of cost. I have many patients who, like millions of other Americans, have lost their jobs because of this pandemic. And because in our country, we don't have any form of guaranteed access to healthcare, about half of the people I care for who lost their jobs lost their health insurance during a pandemic, right? So the patients I have been able to connect with tell me that they're not only thinking about COVID, they're struggling to pay for, of course, their usual medicines, their insulin, their blood pressure medicine, but they really do fear that once there is a COVID vaccine or an effective treatment, that they won't have access to it because they don't have access to any form of healthcare right now. And the platform we're putting forward today would guarantee that they do. And we need our government to guarantee that everybody has access to the care that they need. And so, you know, this pandemic, it's not a surprise. On the contrary, it is, this pandemic is the direct result of the policies we've had in place, policies that have weakened our domestic and global public health systems. And to fix it, we need our government to commit to very strong policies that build back strength in these same areas. Prevention isn't glamorous. Public health isn't glamorous work. I get it. Nobody wants a mammogram or a colonoscopy, but I ask my patients to do it anyway because I know that it could save their life. And right now we really do have an opportunity to enact policies that could save millions more. So thank you.
Thank you so much, Dr. Lixton, for sharing your experiences and your patients' experiences. We wish you all the best on the front lines and all the best for your patients as well. We are going to now move question and answer. The questions have been pouring in. I will do my best, as will the panelists, to try to get all of them. But again, we want to make sure that all your questions get answered, so feel free to stay in touch with us. There should be contact information when you registered for the webinar, and we can make sure those questions get answered if we're not able to get to it during our recorded webinar. So if we could have the panelists join us back now for the question and answer, I'll go ahead and get started. One of the first questions, which I think is really good perhaps for Professor Sax, you were talking about zoonotic transmission and the global implications and global policy that's needed not just from a health perspective, but from a perspective of climate change and industry. And so the question is, I have a question about the prevention of future pandemics. What action will be taken to reduce deforestation and other factors, particularly in regards to agri-industry, that are contributing not only to this pandemic, but future pandemic risk?
Thank you very much. Indeed, these zoonotic transmissions from animal reservoirs to human reservoirs are because of the interaction of human beings with animals, typically in new places, places where humans were not active previously. And there's also a lot of recombinant pathogens that were recombination as a result of agro-industry or breeding practices and so forth. So we need a sustainable land use and agriculture, and we have globally two frameworks where this is supposed to take place. One is the Sustainable Development Goals, and notably SDG 15, which is terrestrial sustainability. And second is the Convention on Biological Diversity, which was supposed to have a major meeting on new goals this year, which got postponed because of COVID. It's also the case that because of the climate change urgency, we need to store carbon rather than releasing carbon through deforestation, which is what's happening, of course, in the large rainforests of the world. We have to end the deforestation and actually reclaim, restore degraded lands, such as abandoned ranches and so forth in the Amazon margins. So that agenda is in place. Again, it's the Trumps and the Bolsonaros that are the real enemy of this. We have remote sensing, satellite data, many things that can make a law-bound, closely monitored, globally agreed framework for land use sustainability. And it is obviously crazy for us not to do so, given the increasing frequency of these zoonotic emerging diseases. So yes, it can be done. Yes, it's even part of the global policy agenda. But no, if you have completely irresponsible, corrupt, psychopathic leaders like Trump, we end up with disaster.
Thank you very much. Absolutely agree here, and your point to the fact that this is not just governments, but also corporations that we need to be responding to here, I think is really well taken. One of the things I think that the Biden plan has an opportunity for improvement is that they do talk about responding to this, as you mentioned. But I think a lot of people would love to see specific sanctions against corporations that are involved in highly irresponsible practices that have global implications. And as again you mentioned, this pandemic, and as other people have said, is costing us money. And if we're going to be putting money into this response, we need to be making sure that we're being held accountable for it and that it's going to the proper places. And benchmarking is incredibly important. So, for example, the World Health Organization does have benchmarking of international health regulations, which is a legally binding set of rules put in place by the world's community for containing new outbreaks. And this would be one example where the Biden campaign can be specific about the benchmarks that they want to hold themselves to and the world to when they're investing U.S. taxpayer money. So thank you very much for that.
If I could add very briefly, we have mapped the world twice a day with low Earth orbital satellites. We can see exactly where the deforestation is taking place on a daily basis. If we cared about this, if we got organized, it can stop. The companies do have culpability and they should have liability in this, exactly as you're saying. So this is completely feasible and very practical.
Absolutely. Thank you very much. That was a question for M28MA. Thank you very much for that question. Next, we have a question from Barbara Burney. Also an excellent question. I'm going to start by directing this to Dr. El-Sayed, if you don't mind. She says that America and Americans have to understand that we are all in this together, and that anti-racism is a critical part of fighting the pandemic and getting healthcare for everyone, not just here, but also abroad. So if you could respond a little bit to how you see the effort to support Biden actually coming out and saying that the public health corps needs to be permanent jobs, needs to be funded jobs, needs to be union jobs, and really be focused on building up and building back better the communities that are most vulnerable and most affected by pandemics. Could you speak a little to the ways in which a public health corps or any sort of pandemic response really takes into account the fact that there are extreme disparities with who this pandemic is affecting, and how we should be responding to that in terms of an anti-racist work, and maybe then a little bit kind of broaden that to, what sort of work could a public health corps do once the pandemic response has been tackled in a way that, again, continues to respond to the disparities that we've been seeing related to race and economic status?
Yeah, no, I really appreciate the question. A couple of points. One of my colleagues on the task force was Mary Kay Henry, who is the president of the SEIU. And SEIU is a union that represents service employees. And when you think about who is most likely to be performing healthcare services in our country, specifically, long-term services and supports, or working in long-term care facilities. These tend to be lower income folks, and they tend to be people of color. And the reality is that her point to all of us, which I think is well engaged in the task force, and we're calling to commitment to here, is that there is no way that we can engage in a fair and just approach to employing people to do some of the most important work in our society if we're not paying them a fair and living wage. And if we fail to do that, then unfortunately what we are doing is perpetrating the same inequities that too many people suffer. But it's not just making sure that people of color and lower income folks have the kind of job security and pay that they deserve for doing this critical and important work, but it's also recognizing that the work cannot be done well unless you are employing people of color from communities in which they're working. Because the fact of the matter is that there, as Dr. Lixton's story, I think, really well demonstrated, is that there is a level of cultural and community literacy that is required to go into this work, recognizing that, in fact, the set of challenges that people face in these communities tend to be best known and understood by folks who come from these communities. And there is a logic that we have to follow that says that the best services that we can offer, especially services of empathy, which is really what healthcare is, have to be from people from within those communities. And so it's not just making sure that you are employing a diverse set of folks to do work in the communities that are hardest hit by COVID-19, but it's also making sure that you are paying them equitably, fairly, and providing them all of the dignities that a good job should come with. And the last point that I'll say is that one of the recommendations that the task force made was a whole of government approach to health and therefore social and racial equity, and through an executive order that would command all of government to be asking questions about what they can do to address inequities, not just in health and healthcare, because of course we know that this is what happens at the bottom of the funnel, right? It's also in housing, it's also in education, it's also in access to good jobs, it's also in air and water rights and resources, that we have to be thinking about all of government to take on the social determinants that tend to funnel down and lead to the inequities that we see in both health and then healthcare. And so this is an opportunity, I think, to tie those together and recognize that the people that we need doing these jobs are people who come from the communities that are hardest hit. These are people who tend to have the lowest access to high quality jobs that come with a fair wage and benefits. And if we are serious about uprooting inequities in health, that means it starts with codifying that in our laws and policies, and it has to end with empowering people from within those communities to do that work and to do so in a way that is respected and empowered.
Could I just add a huge bravo to that, because it's so profoundly right, every word of that, Abdul. And it's an incredibly good idea and very, very powerful. And so proved also as a core intervention of public health. Getting people from the community engaged will massively improve the health of Americans, which was dreadful compared to other high-income countries before COVID. So we already had a case for this kind of cotter well before COVID, but this is 100% correct what you're saying. Perfect, really perfect.
It builds on a lot of the insights of your work in global health, right? Recognizing that we had this notion for a long time in global health that there were going to be folks who came from the global north into the global south, just wagging their finger at people and telling them what to do, and then all of a sudden everything was going to be okay. And I think we've come to appreciate that. In fact, the level of humility and cultural literacy that we require when we ask ourselves about, frankly, how we redistribute large systematic misdistribution of wealth from lower income countries into higher income countries, and then back to those countries, has to come with a level of empowering folks to support and empower themselves. And it forces us to ask a far bigger question about the systems that created these inequities in the first place, and the right way of taking them on. So thank you for your work in that respect.
Yeah. And we have seen what community workers do everywhere is so powerful. So this is, and it is perfect.
And that leads to one of the other core pieces of our platform that we've been presenting, which is that when we talk about global investment and support of countries that are under-resourced compared to the United States, what we're really pushing for is investing in their own public organizations, not saying we want to give money through international aid groups to go do the work there. We want to lift up and support the work that those the institutions within countries are already doing, because again, they know their communities and they know what the needs are, and we want to lift up and support their work rather than imposing our expectations on them.
Excellent, absolutely great comments from all our panelists there. Again, that was a question from Barbara Burney, and I added in questions there from Jason P. As well, a little bit from Eagle. You know, I think it's the question, the answer to the question about what can a public health corps do once the pandemic is done is, if you frame it, it sounds like from a public health approach, it sounds like what I'm hearing is it's almost that COVID isn't really the problem. It's the symptom of the underlying upstream problems of structural racism, structural violence, inequity, health disparities. And responding to that is going to be more than just, as Dr. Lixton mentioned, contact tracing and medicines and vaccines that you know, we want the government to support both domestic and global access to. It really is addressing those upstream issues, and the public health course, certainly that's not mission creep, I think, to say that you are going to work on things, environmental racism, or structural violence. So again, thank you very much for the panelists for those excellent answers. We're getting close to time, so a couple more questions if we can fit them in. The next question, I think, is from G. Verzosa for Dr. Lixton. What would an ideal school system around COVID or during the COVID pandemic look like? I think the pod system, if implemented publicly, has the potential and allow for contract tracing and put people back to work. But what would be, in your opinion, as both a pediatrician and part of the organization that's giving recommendations about this, but also as someone on the front lines and a parent as well, what are your thoughts on reopening and the potential effects it could have on the pandemic?
So yeah, so as a pediatrician and as a parent of a school-age kid, I have some thoughts that I'd love to share. But I think the key point here is that to open schools safely, we need to control the pandemic and its spread in our communities. And certainly educating our children and keeping them safe while we do it should be one of our grandest priorities, and I hope that it is. But we can't say we're prioritizing education by sending kids back to an unsafe learning environment. So number one is controlling spread in our own communities outside of schools. And then two is creating an educational system that's equitable and allows everybody to be safely educated. I agree, I think a pod system works, but I think that we need to recognize that even within a school district, even within a city, that certain schools will have more resources than others. And so we need to, again, support the school environments, the learning environments, the teachers, the families, and give them what they need in order to safely educate their families, because we are going to have an opportunity gap in this country related to education that just widens exponentially if we're not really thoughtful and intentional about how we pursue this moving forward.
Thank you so much for that, eloquent response. We are getting close to the end of time. There were a bunch of other questions. I do apologize that I can't get to them during this hour, but both in the chat link and during registration, there are ways to reach out to Right to Health Action and us. And you know, if you have any further questions, please feel free to be in touch, and we can provide answers not only from the organizers of this webinar, but also our panelists, and would be happy to continue the conversation. This is a very important conversation that our panelists have really sort of set down. Again, it's absolutely essential, as both Professor Sax and Dr. El-Sayed said, that we make sure that Biden is elected in November in order to implement any of these changes. But one of the ways, or some of the ways in which the Biden plan can improve, is making specific these policies that are coming both from the front lines and policy experts like Professor Sax and Dr. El-Sayed about making sure that we approach this in an appropriate and ethical and meaningful, sustainable way, where we are recognizing that the work people are doing on the ground is work. It's not a volunteer, that we recognize that taxpayers are contributing money to development of research and vaccines, and the government should be protecting those investments and not allowing corporations to profit during the times of a pandemic, either domestically or nationally, and supporting the international distribution of vaccines and joining the rest of the world in supporting that, supporting the public health infrastructure, not only of our country, but other countries. And again, these will have global effects, as everyone said. And just to conclude, is that you know, what the work that Biden is setting out to do, and that we are hoping to refine and focus, really will have global effects in terms of environment, in terms of racism, in terms of geopolitical scale and politics, as well as in terms of public health. One of the things that we're going to be doing and have been doing, but that's going to increase in frequency as we get closer to November, is that we're going to be setting up hundreds of meetings between experts like your panelists and members of Congress. And if you are interested in joining us and pushing these demands, not just with Biden, but also with Congress, to make sure that we hit the ground running in November, please get involved. We have a link in the chat box, both of the Ustream and the Zoom. So please feel free to reach out to Health and participate in making sure that we are better and that we are creating a bolder, stronger pandemic plan, not only for Biden and members of Congress, for the United States and the world. So thank you again, and I'd like to thank our panelists for taking the time out of their very, very busy schedules, joining us and sharing their thoughts and wisdom and the work they're doing behind the scenes to really respond to the COVID pandemic, or on the front lines as well. So thank you everyone for joining us. Stay safe and good luck in all your work.